Hello.
Great. So hi, I'm Dr. Shauna Daru, and today I'm going to be speaking with Dr. Marika Burney about her approach with children and teens.
Hello.
Hi, so let's talk about teens first.
Okay.
Can you tell me what some of the ways you can support teen health are?
Sure. Over the years, treating all my adult patients, they would often list their concerns with their teenagers. Things like sleep disturbances, anxiety, depression, acne, poor focus and attention and performance in school. And so I started to treat them and realized how amazing naturopathic medicine was for them, and that they responded really, really well to naturopathic tools. And the other thing I realized is that a teenager will listen more readily to a stranger giving them advice than their own parent.
That's true.
So teens can be supported by educating them about their diet, nutrition. I also think it's really important to investigate whether there are any nutritional deficiencies, vitamin, mineral deficiencies, hormonal imbalances, and we often do that through blood work.
Yes.
And then I will support them using these naturopathic tools such as botanical medicine and nutritional supplements.
Mhm.
I always talk to them about their diet and making the right choices. And we also discuss lifestyle modification. Things like devices and proper sleep routines
Right.
are tough, but it's important that they learn that those are really important when it comes to their health. And then also, of course, I encourage lots of regular exercise. I really love to empower teenagers because it's important to give them the information, knowledge that they need to be able to feel powerful and strong and do really well in school, in whatever sports they may do. And also you can really help them feel good about themselves by helping them to learn about a good diet and maintaining healthy weight, and helping to reduce some of those outbreaks of acne as well.
That's a good one. So that leads me to the next question. What about hormone balance with teens?
So I've spent most of my career helping to balance hormones in my patients, and the teenagers have their own cross to bear, of course, and that's called puberty. And at this point for teenagers, hormones that really didn't have a huge impact on their health are suddenly surging. So for example, testosterone can have a huge effect on both boys and girls by creating outbreaks of acne. And so they're both affected by this. And then in women or girls, imbalances between estrogen and progesterone can also have an effect on menstrual regularities, heavy periods, painful periods. Also something called polycystic ovarian syndrome sometimes can appear at that age. And so naturopathic medicine, again, is a really, really natural, positive approach to helping to keep those hormones in balance. And again, we can assess those through blood work, and also just by looking at what signs are appearing. And they can be improved by diet, nutrition, botanical medicine, and all those tools that naturopaths have.
Amazing to identify it early, right?
Yes, absolutely,
Yeah.
because those will, that information will help them later on when hormones can change more.
That's right. Yeah. And what about working with school-age children? So what are some of the conditions you can treat there?
Well, the common conditions I will see in my practice with school-age children are things like chronic colds, flus, ear infections, skin conditions like eczema, asthma, allergies, a lot of digestive disturbances, and as well as mood changes. So they can also be anxious and feel low mood. And so I feel that they respond also really well to naturopathic intervention. It's very gentle and natural, and you can see huge changes in their health.
Anything else you'd like to tell me about your approach?
Yes, absolutely. A typical visit with me is about an hour and 15 minutes, and it will involve an in-depth analysis of the current health and also past health history. I will look at diet and analyze it, and at that point I'll suggest any further testing. Often I will do blood work with my patients if necessary. And then I put a plan together. And so that plan will incorporate nutritional suggestions, also nutritional supplements, botanical supplements, and usually the patient will implement these ideas for about a month, and then we meet back and make sure that they're doing well and change things as we need to. It's always my goal to give my young patients the tools that they need to recognize in themselves when they feel good and when they feel bad. And when they feel bad, I want them to know that there are really effective things that they can do to help themselves feel better. You know, making sure they go to bed early enough, doing some exercise, and also just eating the right things. I think as parents, our goal also is to raise independent people who will very quickly be off to university and not under our care, and we want to make sure that they learn these things early in life so that when they are on their own, they make the right choices and decisions for their health so they feel good and are successful and happy.
Amazing. Great. So thank you so much for listening. Dr. Burney is at the Duro Wellness Clinic every week, and we'd be happy to see you.
Thanks. Bye-bye.
Bye.